Hello, good afternoon, and thank you for coming. I'm Casey Cowie. I am a family physician and the medical director at Elevated Community Health, which, if you don't know, is right up the hill, right next to the hospital. And we are very excited to present a special topic on memory matters, early detection, and living well with dementia. This topic is near and dear to many of us, affects many of us personally or our family members, and is something that is extremely important to talk about early and often. And so we're very thankful to the Alzheimer's disease and related dementias initiative that allowed for this event with a generous grant to be able to bring in a special speaker for you. So I'm pleased to introduce you to Dr. Seth Kramer. He's a highly experienced primary care physician and an assistant professor in the Department of Family Medicine at the University of Colorado Anschutz, where he served in primary care since 2017. He is a diplomate of the American Board of Obesity and board certified in obesity and obesity management, and research interests include obesity, diabetes technology, diabetes, metabolic disease, and dementia. I first came across Dr. Kramer through an article that he co-authored in the American Family Physician Journal on the evaluation of suspected dementia this past December. And out of the kindness of his heart, I cold called his office, and here he is. So, so we're very pleased to bring him here as a special speaker on this topic, and take it away.
Wonderful. Thank you, everybody. It was a wonderful drive up. I gotta say, getting out of Denver is just like, it's fantastic. I want to ask you a question to start, and then we can get into understanding some things, understanding our pathway and how we can navigate this new world. And then we're going to have some friendly neighbors of yours here in town to just kind of talk with and find out maybe how their experience with navigating this whole world, because it's can be scary, can be difficult, but it doesn't have to. And we have a lot of resources to support you and caregivers and family and so forth. But I want you to just think about someone that is very near and dear to you. Someone whose voice is of reason to you that you think about in your family, and then think about that slowly their personality or their thinking and their thought processes kind of change. It doesn't happen fast. It might just kind of be missing a word here or there, might miss a doctor's appointment, might get lost or just kind of forget things mid-sentence, so forth, but that might happen. And think about that person, because that's someone that you want to be, you want to think about and you want to be able to support and be able to navigate and walk with as you go, because the caregiver and the family members are also as important as those that are, have something like this to work through, along with your medical team and your support team. So I just want you to keep in perspective that it is we all know that's a significant disease process, and in just the 90 minutes that we're going to have today, we're going to see probably about 11 people in the U.S. here, get diagnosed with dementia. okay, in just like 90 minutes. So you can kind of imagine that that's going. That's diagnosis. That's not those that have it, because they likely have not been diagnosed. A lot of times that gets delayed, whether it's a delay in accessing care and knowing what to do and how to do it, and so things get delayed, or it might be a delay by access to care, period, and the right people to kind of get in and help support. So I want this to be interactive. I'm more than happy with questions that anyone has throughout. Please just let me know. Stop. I don't know if we have anything in terms of questions available, but if you don't feel comfortable speaking up, we'd be happy to. You can kind of write it down, and we'll have an opportunity kind of at the end to also kind of answer some questions that anyone has. Okay, so feel free to stop here. But I want to spend just a little bit time in terms of the medical picture around it. Okay, what do we know? What is it? Myths, things to kind of look out for. And then how do we support ourselves? How we navigate this? What are our support team? What do we do? What's our first step? Like, where do we go with this? When do we go? How do we go? I mean, there's a lot of questions that come up. Should I go? Maybe it's just forgetting some words. I mean, should I go? So I will kind of answer some of those questions, and then we'll have an opportunity to kind of delve in a little more personally in terms of some experiences navigating that world. Okay, so no one has to raise their hand if they don't feel inclined to, but I just want to understand those that are here. Anyone who's here because they're worried about like their own memory, or they're concerned about themselves. Okay, a few of us. I'm going to raise my hand on that too. How about a family member or a friend or neighbor, right? Okay, we've got a lot. Okay, how about anyone who's a caregiver right now? Paid, unpaid, there's caregivers, right? Who are currently taking care of a family member or supporting them. Okay, anyone who's just curious, just to kind of learn or find out about it. It's okay, you can be like 2 or 3 or all of them. Okay? So a lot of us, I mean, that's partially kind of why you're here today, but a lot of us are curious and inclined. There's a lot of myths out there. And, we have treatments and testing, and this world is changing like rapidly, So, it's always good to engage when we need to, because there are always new things that come up that we're aware about that now we can maybe do something with. Okay. What is it? Everyone has heard the term dementia. They might have actually heard the term Alzheimer's. Does anyone understand or know that there's a difference, or what's the difference between that? Anyone have any idea? Because those words get thrown around a lot, okay? And the way we want to think about that is that we can think about dementia as like how we would think about someone having a fever with like an infection, okay? However, there are other things that cause fevers, okay? Your temperature to go up. Not just infections, there are other things, okay? So dementia is just an overarching thing, and there are a number of things that can cause dementia. Alzheimer's is one of them. There are others, okay? So think of dementia as a whole, and then these either subtypes. However, as I will mention later, there are things that are not dementia related, but look like dementia. right? And so you go to find out what's going on, and it happens to be a medication that you're on. And you're having cognitive issues, or you can't think very clearly. And in fact, actually, it's just the medication. So there are lots of mimics. There are lots of things that look at it. What is it not? Okay, not a single illness. Okay, like I said, it could be multiple things that contribute to it. It is not a normal part of aging. Okay, we're not all guaranteed to get dementia or to have any of this. Okay, and as I will mention too, there are a lot of ways to modify in terms of our lifestyle and the things that we do that we can prevent this. Okay, and that is going to be an important piece. It is not an automatic loss of yourself. Okay, you can still engage, and we make some changes and we adapt, but you can still engage and have be who you are. You're not going to lose as a whole. Okay. And it definitely is not something that you should need to hide. And it actually is quite present, as I mentioned before, it's quite present out there. It just is not forefront, and we don't see it as much. 1 in 9 over 65 has dementia right now. Maybe about 10% or so, 11%. Okay? If we take about, I don't know, do you have maybe about 3,000 people in Frisco area? 3,000, about a quarter of that is over 65. And so that is about 60 to 70 people here in the area that might have dementia or dementia-related things that, whether we know about it or not, that are right here in your community. Okay? So, it affects us all, just on different levels. Okay. It is not one disease, as I mentioned. There's dementia. Just think of it as, we throw the term out, but there are subtypes, there are types that we talk about. Alzheimer's is the main one. About 2/3 of dementia subtypes or causes is Alzheimer's related. Okay, what is Alzheimer's? It's basically, the earliest thing is kind of short-term memory changes. Okay, you kind of that short-term loss, recent events that you have that you forget or you can't recall quickly. I'm not talking about long-term kind of memories, just that short-term. And then language, being able to kind of your thought process and your judgment. So some of those things start changing. Those are the advancement of it towards the middle and end is those things. But that beginning is really just that short-term memory, loss of words, missing appointments, things like that. But that, again, is not always dementia, right? So we lose those words. I lose them too. And some of those it has nothing to do with a memory loss or cognition. And then we have, alternatively, mild cognitive impairment, which has nothing to do with dementia directly. And so you can get some slowing and thought process changes with aging. Okay? And that's that. It's not dementia. So it can be kind of hard at the beginning when you're losing some of these short-term memories and things that, you're thinking about this and you're thinking that there's dementia here or not. The key thing that it kind of comes into play is that is it really interfering with your life, with your quality of life? Is it really causing an issue? More than, I forgot my keys. Where's my keys? I forgot my keys and I don't know where I got lost. I don't know where I go. And you all know how to get here, and you forget where you're coming here, or you kind of go off somewhere else, and you kind of get that lost there when you used to like be able to do that, and it happens a little bit more and more and more often. That's something that is different and changes than just kind of forgetting something. Okay, vascular dementia, the next type. Has anyone heard vascular dementia before? Vascular dementia, okay, it's kind of in its name, but it's related to cardiovascular disease, stroke, heart attack. Those that have recurrent stroke, so forth, that's essentially like having a heart attack up in the brain, okay? Well, it affects the brain's ability for thinking and cognition and so forth. And so there's a related vascular component to that. It's why we focus on cardiovascular disease prevention and stuff, because that is a big piece. You can have vascular dementia and Alzheimer's, because you can have cardiovascular disease and you can have all that. It's really kind of a somewhat of a presumptive diagnosis that's made because we understand your medical history and you've got this strong history of whether it's a stroke or cardiovascular disease, and then start to develop some of these findings shortly after. So it's kind of there, but it's not something, and you can see some things on imaging and so forth, but it's not anything that, there's a test and it's like, this is vascular dementia. It's kind of made by support with everything and your provider. And then there's a couple rare kind of causes. There's frontotemporal dementia. You won't see that too often. And that really is a lot of personality changes, shifts. It's affecting the front of the brain, which is a lot of behavioral and judgment. It's how we kind of make those decisions, and that gets affected. So they make inappropriate behaviors and decisions in what they're doing, and that becomes more and more. Okay, that's and then there's Lewy body. Robin Williams passed away. Lewy body. He had Lewy body at the end. They found out. There's a little correlation with Parkinson's, which he had with Lewy body, but there's that. Okay, rare, very rare. And so what you're going to find is really why we hear about Alzheimer's disease is because it's about 2/3 of, the types, and it's more common. But cardiology or cardiovascular disease, I think, is important. You can keep that in mind when we maybe talk about prevention and how do we, continue to engage in our lifestyle and movement and our diet to kind of prevent some of that, because that's a big play into this. Questions at all? Any concerns? Is anyone?
Is there any evidence that it's hereditary?
Alzheimer's or as a whole? Alzheimer's. There is some increased risk when you have a parent, someone with confirmed Alzheimer's. Okay, vascular dementia, otherwise, not necessarily inheritable, except the cardiovascular disease. There's a strong history of stroke, and your family has a strong history of that, and so thus you may develop that from that. But Alzheimer's is not a guarantee, and I will mention there's testing now. There's some labs you can do, and there's some imaging things that we can kind of help confirm things. And you might hear about a genetic test that you can look at from an inheritable cause of dementia. But the unfortunate thing is you can be positive for that and not develop dementia. You cannot have it and develop dementia. So we know that risk goes up more with it. And that's, there. We don't have a perfect thing. So It's not a guarantee that just because you have it. What is a risk is when you have a parent, with early onset dementia. And sometimes I've seen it in their 40s and 50s, where you develop Alzheimer's dementia, that early onset, okay, that can have a genetic component to it. But other than that, I will mention that about 50% of what we do is preventable with dementia. So we can partake in this and actually help prevent some.
Any relation to living at higher altitude and or hearing loss?
Great question. You'll see something on that, but I think hearing loss is a risk factor for dementia. Not a guarantee, but it's one of the risk factors. Elevation, not directly. I think some of the other things, those that are kind of up at elevation also tend to be, they can be more physically active and moving around and doing a lot of that. And I think that counters some of the things that maybe you'd see. And it depends on access to resources and care and be able to do things like that. That is more of a significant thing to think about than just being at elevation.
Seth, can you explain the relationship between frontal white matter that is with MRI testing along the way and how that is related potentially?
Yeah. You might see if anyone gets an image of their head at some point, or for other reasons, and you might see small white matter changes or small vessel changes. You might see that. You might see things like that. But when you see kind of atrophy or decrease in the brain size, which can happen with aging of the brain, but you can see that and the white matter changes. And depending on where it's happening, to kind of correlate with dementia and the development of that. So when we talk about Alzheimer's disease, it's a deposit of protein, okay? These amyloid proteins and stuff, and it, over time, you start to develop dementia from that. However, and these things are develop where you see this white matter changes that is on the imaging that you get. It by no means is like we see this and that's that. You gotta kind of put the whole thing together. It's not just like on imaging and you're like, oh, you have dementia. Yeah, no, it's bigger than that, right? It's like anything where we have all these pieces and we kind of have to put it together. Now things are changing and improving where we can make better diagnosis of understanding that, but it really takes a lot to kind of help make that diagnosis there. And the biggest thing is, again, aging and mild cognitive impairment that we might see versus dementia. Because at the beginning, you might think that there's some other things, but not everyone who has that kind of slowing and some changes is dementia and goes on and has all that. So that's where we kind of pull in everyone to kind of help make some of those diagnoses when we're concerned about it, or we start using our tools to kind of do that. Okay, you got a little quiz. I'm gonna ask you, you're gonna forget one of these signs here. Is it normal aging or is it potentially dementia? Okay, you forget where you put your keys, but you remember them later when you kind of retrace your steps, you kind of go. Are we talking normal aging? Normal? Okay, has anyone done that? Oh my gosh. If you have, I'll show you my keys. I got one of those air tags on them. So Actually, everyone makes fun. I have tagged everything because I just lose it all. But that's not dementia, right? It's just like, you're just putting something down and you're not present. You're not there, so you're not paying attention. Like you're somewhere else, and so you're not thinking about it when you're doing it. What about you're losing track of what year it is, the season, or where you are right now? Like you kind of like not sure. What are we thinking? Normal? Not normal. Okay. Okay? Dementia? Maybe not. Warning sign, right? Again, if it is it's interfering, right? A one-time kind of like I kind of forgot something, but it's not a recurrent thing and an unusual thing, right? Is can happen, but when that happens a lot, then you're paying attention. How about it takes you a few extra steps to learn how to use like the remote or those stupid phones that are like becoming so complex. I don't even know what I'm doing. Normal? Maybe we should have gotten rid of those phones because it's like, no, it's normal, okay? Normal. It's okay that you don't know how to use the phone or the remote that's got, like, sometimes I don't even know how to turn the TV on anymore because it's like 5 buttons just to like kind of get this thing, right? So it's okay. And I just gave you that one. But you should think about, you're stopping mid-sentence, okay? You call things by their name, kind of wrong names, okay? Or you're kind of withdrawing from conversations. And it might be different than what you know either of that person or yourself to do normally. And part of it is that you're still kind of present there to know that you're struggling. And so you kind of just withdraw yourself from that conversation or other conversations now because it's frustrating. And so then you just kind of start pulling back, right? Others, your caregivers, other family members will notice this more than oftentimes yourselves. Okay. So 10 official warning signs. Things that I would say you watch out for now. Kind of getting to, again, not dementia guarantee, but like what should kind of come to mind if you start seeing these? I'll just mention a couple here. They're important, but memory loss, right? However, it's memory loss that is really disrupting daily life. Again, not forgetting the keys, but forgetting where I'm going, or forgetting mid-sentence and just can't do that. And it's kind of starting to be a little more recurrent. It's not because you didn't sleep last night, or there are other causes, secondary causes, medical issues that again mimic that. So there's not other things, right? So, but memory loss, that's due to that. Okay, poor judgment. Okay, decision making. You might be making some poor judgment calls, or you get scammed by someone on there, and it's not your usual, but you just get pulled into these different things, or you're making different decisions that just are not your norm. Again, family members might notice this different kind of thing that you're doing. And then like withdrawing. Okay, you kind of withdraw from activities and work. Okay, so we have to, again, it's a warning sign, but it's not dementia by itself, because what can you think about that kind of replicates or kind of thinks is something similar? Depression. People that have depression or experiencing something like that, will kind of replicate that, and they may not verbalize it or talk about it. So it can be hard. You might, as a family member, might think this is there, and it really is depression related. So just think about, these are warning signs that we kind of put together. But if you're seeing many of these or experiencing many of these, then maybe it's just time to engage in early inquiring with your provider or your medical team and stuff, and just kind of talking about it. Have a conversation. Okay. The brain changes. These things happen 20 years before symptoms appear. So it's not happening, a couple weeks ago and all of a sudden you get dementia. It's been happening for a while. Okay, the brain's actually kind of changed, and then we start seeing symptoms of it. Okay, so we see symptoms of it, and that's what starts appearing, right? But it didn't just happen the day before. We saw changes. We see white matter changes. We see these things that happen that then develop into what we occur. Now, we have, and just in the last few years, more and more, we have some biomarker tests. There are been some that are available, and they're getting even better and better. They're not a guarantee that it is what it is, but they have very high, we call it sensitivity, meaning when it's telling me you have something, you have it. And when it's not telling me you don't have it, you don't have it, right? I don't need a test that tells me that you have something when you really don't. Okay, that's not great either. I need reliability. So they have, more and more, they have some better reliability to help kind of clarify a diagnosis. Okay, and I'll tell you about a few that are here and some that are on the way. Medications. There are no approved medications that actually totally cure Alzheimer's, dementia, and so forth. Okay, we don't have it yet. You'll hear about a few medications that might come up that sometimes can help modestly with symptoms. And then now there are a couple newer ones that actually target directly this protein buildup to actually improve and decrease the or delay the onset of dementia or progression. Okay, and I'll mention those too. But kind of getting to something that you mentioned is, there's hearing loss and there's these other symptoms that we have. And about 45% of what we see as dementia is modifiable. We can do something about it. We can do something to prevent it. I would probably gather to say that you do some of it already, but I think that's the important piece. And you have to engage in that. You have to keep doing that because that's going to be very helpful. They just put out, Lancet's a big journal, big commission came together, Europe, US, they had the Lancet report on the modifiable risk factors, okay? And there are 14 of them that they determined. A lot of them are hearing loss, blood pressure, so when you have hypertension and your blood pressure is up, okay? Sleep, people that have sleep apnea or their sleep's affected significantly, can put you at risk for dementia, okay? Because our brains clear these proteins while we're in our deep sleep, okay? And if you're not sleeping, you're not getting into that deep sleep, right? So that kind of comes with when it's disrupted by a number of things and you're not sleeping very well, and these things happen, this is, a risk factor. Alcohol, tobacco use, pollution. We see higher rates of dementia down near Denver, near Commerce City, and near that Suncor plant. What a surprise. I mean, it's mind-boggling, some of these things. Now, in theory, it's modifiable, but for some, not easily, right?
Sugar.
Diet, sugar. And dental. Dental is, we have our dental, I would be amiss if I didn't mention dental. You know, the teeth are related to a lot of things, and we don't give them a lot of due credit. We've got to pay attention to our teeth. But dental disease, infections, things like that would kind of add to, your risks that, some of these things are modifiable and we should be doing them earlier on in our life, but we need to then also do them now to prevent advancement or change. But these are things that you can do. I'll say the biggest things: movement, exercise, use your trails of movement and walk. And those that walk several miles a day, or even just modestly but daily, is significant to helping. Okay, and then diet, again, related to teeth, sugar, processed kind of foods, and the things that we do, and the high processed level of stuff that we do, and if that's a regular kind of part of your diet, that affects it. Alcohol, absolutely. There's no safe level of alcohol that we're kind of aware about, but you do see it on a significant intake of alcohol level, per day or per week, that is correlated with even a higher. So the more that you're drinking on a regular basis, does it relate to dementia? And you might, if you've ever, met any family members or know anyone who consumes a lot of alcohol on a regular basis for a long time, tell me about their cognition and their memory, because it's probably being affected, among other things that they have going on, right? They're definitely not probably, walking around or moving. Their diet's probably not great. So there's got a lot of things that contribute to it, okay? Okay. This is the cool part, basically the biomarkers, okay? We didn't really have a whole lot a few years ago. It was kind of a clinical diagnosis, do some screening, we'd kind of do a more in-depth diagnosis, and then we would, we might have some imaging, and then we'd have to kind of we'd get some help with like a neurologist, something to help make that diagnosis of, is this cognitive impairment or is this dementia? But we have biomarkers. So we've got a few imaging biomarkers. These are imaging like you would go get like an MRI of your head, where you get a PET scan, but these are specific for this. It's not just getting an MRI, but it's getting like the specific PET scan, which is used as a little radioactive tracer, and you can see this protein, this amyloid protein buildup, okay, with this PET scan. So you can quantify, you can see kind of how much, and you can see that there's a burden of a lot of this amyloid buildup in your brain, basically there. And so you see it. Now, that being said, and it's about 90% accurate in terms of, dementia versus like Alzheimer's, and the subtypes and things like that. But 20 to 30% of those over 65 can have amyloid build up, and they have no signs of like dementia or cognitive changes. So we would not use an imaging like this as a screening just to kind of everyone do it, because you can get a false positive. Okay, you can get this and you're okay, but you got this finding, now you think you're going to get dementia. Well, that's not a guarantee. We use it when we have someone who either has symptoms and we're concerned about dementia, or we are indeterminate. We're not sure. We think they're there. We don't know exactly what's going on, but you're showing a lot of signs, and we use that to help support, okay? So it's not a screening like you would get. Like many of you have gotten a mammogram or a colonoscopy where we're screening We're looking for it. We don't use it for that. We need to have symptoms usually present, but earlier better than later. Earlier in that process to do it. Okay. There is a blood test. There's a few, but the one that's just approved this last year, 2025. Okay? And it's a blood test. It correlates with the amyloid PET scan and the amyloid kind of buildup that kind of makes its way into the bloodstream, and you can see that. Okay? 91% kind of correlated with that amyloid PET scan, meaning that 91%, it's like you see the amyloid build up, on that image, and you also have a positive test here. Like they go hand in hand. Okay, you don't get a lot of discordant results, meaning the imaging says it's present and the lab says it's not, right? Okay. It also has negative, so meaning it's not positive, it's not there. 97%. It only leaves about 3% there that it is there when it is not. So when it's not positive, it's a great sign, right? We want testing to have high reliability so we know what we're interpreting. Okay, we can't tell it again that it tells me you have something or you don't have something when you do or don't. It's got to kind of do that, or we shouldn't use it. So this is new, but again, just like the PET scan, we're going to use it in someone usually over 55 who has symptoms, not as a screening. So you wouldn't go into the office now, to your primary care and say, like, I want the Lumipulse G lab test. Well, let's talk. What symptoms are you having? You go through it, but if you're not, then you're going to get a potential like false positive, or you're going to get a positive test potentially, yet you're not going to have dementia or kind of go on. So you need to do it in someone who's having symptoms. But again, earlier in that course than later. It's not someone who does have dementia is advanced. That's not the time to do it. It's going to help confirm the diagnosis, right? But now I mentioned those, and I said, well, it's going to confirm that diagnosis or help us. So now what? Well, we've got some options, but we don't have anything to like cure it or stop it. So that's a decision to be made with the team to get lab tests or to get this imaging, if there's something you can do about it or not. If there's someone who has a family history of early onset dementia, we're concerned there's a little genetic cause. And now their kids in their 40s are like, I'm concerned about this. Well, they may decide they don't want to test and look. Can't do anything with it, so I just want to go. Some do. Some want to know because they want to prepare and they want to do the things that they want to do and be able to do it and know where they're going. So that's a personal decision, okay? And I think that's something that, you think about when you're making that.
Shouldn't you know if you've got amyloid and you start taking anti-amyloid medications?
Absolutely. And you will need, for Medicare, now we'll cover these, but you need testing to confirm that there's amyloid present before doing amyloid-directed care. So you will have to, so that's another reason why you will do lab testing and imaging, because you're interested in maybe confirming the diagnosis and you may want to start treatment or medication-wise. And to do that, you will need the testing to confirm it. Otherwise, it may not be effective or not. You've got to know that you've got it. So you will need it, and that's a requirement to get those confirmed. There's another testing on here that I didn't kind of mention, but it's called CSF testing. It's the fluid that's around your brain and spine here. If anyone's heard of a lumbar puncture, so they go and they just do a little sample here back in near the spine there, and they get a little sample. They get the fluid there a little bit, and then they test it there because you can see the amyloid going there. However, it is left to really, it's a slightly invasive but safe kind of procedure, but it's kind of left now. We got this lab test, we got imaging, and then if there's still some, concern or, we're not sure, then may proceed with something like that, okay? That also is one of the tests kind of required for this directed treatment. So it just depends on, obviously, insurance and coverage. And why do they want that? Well, one, they're very expensive. $100,000, maybe even more. So we gotta make sure. And the US is probably like one of the places that they do kind of cover it, but you go over to Europe, Germany, Holland, stuff, they don't even cover it. They won't even do it because I'll tell you why. I mean, there's the pluses and minuses to it, and it's expensive, and that's part of their health system in terms of the outcomes that you see from it versus going through it and things that you have to monitor. It can be kind of modest results in terms of using something like this or not. Okay, and so I will go tell you that just in a sec. The medications here. There are, again, anti-amyloid directed, specific. That's the buildup. And they're directed to that. They show significant improvement, but it's modest. Significant, don't confuse that with it's a positive result, but it's a modest result. Okay, and I'll tell you why in a second. Slows down cognitive impairment and changes. Okay? And then there are some symptom, you'll notice sometimes they use some medications from a symptom management, agitation, behavioral changes, and they'll use some of these medications. Again, modest improvement with using that, and a lot of times they have side effects that are like, well, not worth kind of using that. They can be somewhat expensive as well. So, sometimes you'll do a trial or so of it, but sometimes you decide not to kind of use it, and it doesn't change progression at all. Okay. Yeah.
Does diet matter?
Diet, absolutely. Diet just in general?
Yes.
Absolutely.
What's best?
We constantly find, a Mediterranean style diet. If you're talking diet, low in sugar, again, processed, it really is important there for that. Good fats, okay? So unsaturated fats, olive oil is an unsaturated fat versus trans fat or highly saturated fats, that you might find in a lot of processed foods and things like that. So diet matters because one, that's your health, and two, cardiovascular disease that can contribute to vascular dementia. So, it goes around, and it's one of the modifiable risk factors to pay attention to. You don't need to kind of read all this little print and understand anything here. But this just says, hey, there's a lot of good kind of diagnostic accuracy to some of this testing here. That's just saying up towards 100% there, okay? And the green and the blue basically are, we call statistics in terms of sensitivity and specificity. And that's just how well does the test kind of catch the disease when you do have it, and how well does it tell you you don't have it when you actually don't have it, okay? Okay, and that's how well it does. So they're a lot better. Okay, and however, you'll notice there's a number of them that have a lot of dollar signs. But with development, and there is a lot down the pipeline kind of coming, especially this, that all starts to probably come down with some time. But it is expensive, and a number of these, they're not covered by insurance. On oftentimes, like the blood tests that I told you about, not often even covered. About $200 to $300. So it's not out of the reach for some, but it is still expensive for that. On up to that amyloid PET scan that can be like $5,000. Now Medicare is coming around and they're starting to kind of cover these, right? Really, if you're showing them you're going to use some of the medication directed stuff, will they kind of cover it? If you're just getting it, they're not generally going to do it just to look. So sooner or later it'll kind of come. There's more blood testing and things that are kind of coming out, and a lot of that will be kind of more within reach. All of this, again, not screening. It's with someone who has symptoms, and now we're thinking about maybe medication-directed treatment-wise or not, and so we're kind of using this stuff to do it. Okay, older meds help with symptoms. You still see them around. They don't slow the disease down at all. Okay, you'll probably see maybe quarter people might get some benefit, like in their symptom management. Can be modest. The benefit's real. It's just it can be a modest, in terms of how much. It can be small. And then the side effects, okay, can be significant for some. Okay, and so that kind of is usually what maybe why people stop. Is there several $100s, maybe a year. Okay. Medicare and those will often cover those now, but and that's used at all kind of stages there if they're going to use it, versus the newer ones that are kind of out. There was one, and now just another in the last year or so came out. They do actually slow the progression down. Okay, about 35%. But let's put that in perspective. You will expect maybe, cognitive changes and progression in maybe about 18 months. Use the newer medications, and now maybe it will be about 22, 25 months. Okay? So 4 to 5 more months of improvement. So what you need to do is, well, for some that maybe that's worth it. They want some extra time for that, but you should not be persuaded by percentages. But really, what does that mean? 35% of what? Well, it gives me 4 or 5 more months, of delay in that. And if you put it in a different perspective like that, or you ask that question of what that means, then you get to understand that, well, for me, maybe that's not enough, just a few more months versus a few years. Maybe that actually makes a difference, okay? It'll get there. It's coming. Does anyone know Ozempic? If you haven't watched the news at all, it's like, right? Weight loss med, diabetes. Ozempic's the diabetes med. Wegovy's a weight loss side. There's a current study right now of semaglutide, which is the med, in dementia alone. And we see in dementia almost like a third type of diabetes. It's high sugar in the brain, okay, and a lot of inflammation. And medications like Ozempic and stuff, they cross the blood-brain barrier and they decrease that. They're actually looking directly at, do they see an improvement in either prevention of dementia or progression of dementia with that? Now, to do that, it's going to be a bit of time here. Like you can't just do 1 year and then like, oh, it works. You're going to have, it's going to be a little bit. But it's a potential, right? So there's going to be more and more coming. There's some side effects of brain swelling and some risks of bleeding. So for 4 or 5 months extra, you have to kind of weigh that risk. You got to get an MRI before you start, and probably about 3 or 4 over 6 months to make sure that you don't have these adverse effects. So now think about, is it worth it? For some, maybe still. But that I think you need to kind of consider right now. But again, engage in these things because they're ever changing and improving. Okay, so we got more. There's so many down the pipeline that it's going to start getting better. So just keep that in mind when you're thinking about it. And this is just explaining that part, that, you know, it's kind of modest in that. Okay, so what do you do when you think, hey, you know, I'm concerned about this, or my caregiver, my family member's kind of concerned? Like, where do you go? Where would you go? Where would any of you go to if you had a concern, you're losing your words, or just some short-term memory? Like, what would you do? Primary care? Yeah, be your first. Anyone else? Go back to neurology, if you're either in, or if you can get in like 6 months, 9 months. But yes, neurology can do it. This can be hard. Do you have a lot of neurology up in here? One? Part-time. Okay, you got part-time neurology. So, but there's ways to engage in those guys, not just who is not here. But you want to notice and you want to document. You just kind of like make notice and think about it. Because if it's becoming an ongoing, recurrent thing, it's disrupting kind of life, and those things are happening, do it. But write it down, document it, keep kind of thing, and pay attention to it, because you don't need to rely on your memory to kind of do it. Keep that, because you can bring that in and say, these are the things I'm noticing. You know, what can I do about this, or I'm concerned about this? And you can have a conversation with your primary care. So get into your PCP, get in your primary care, and talk about it. Because we can do screening, we can do initial screening, we can do a little bit broader kind of screening, and have an idea that there is some changes here that we're seeing that we want to help clarify and look further into that and help support. Okay? And then we might bring in that neurologist. Sometimes we bring in what's called a neuropsychologist. Has anyone heard of them? Okay, so you might go through a neuropsych eval. It's a long afternoon. They're very in-depth things, but they, will see, several in a day because of that or less. And thus, ours down in Denver, 12 to 18 months sometimes. So it takes a little bit. There's not a lot of them. They do that. They spend a lot of time, but they're there. A lot of the neurology groups and stuff will have them, a part of them too, so they can help. They help facilitate some of that a lot easier. But they're a part of that team. And then you're going to use your team here. So like, your PCP, your primary care, and you're going to engage with them. And there's a lot on the team that can help support. Okay. So what we want is for you to think about when you do see your primary care, and your primary care will, with screening, or if you already have, an underlying diagnosis and you need support, or you're there with your caregiver, your family member, and they need support, okay? We have resources. And so we want to engage in with our primary care, who can kind of help coordinate and do those things. But then we have access to our behavioral health, our psychologists, okay? There are things that happen with memory loss, frustration, behavioral changes, agitation, and so forth that our behavioral health providers can come in and help support. Okay, so I think it's very important to include them. And then, outside of our neurology, because you have maybe a part-time neurology here, you can engage via telehealth with neurology. It doesn't have to be down at CU Anschutz Neurology, but any of our neurology, even down in Denver or up in the north part, there's a lot. They engage a lot with virtually telehealth, which you can then engage with to kind of help do that. Where they can do a lot without you being like present in the room. Your caregivers and your community and your case workers, your case managers / social workers, things that support, okay? So there's probably a lot of resources and things in the area that you are likely not aware about or know about. And those are important to hear about. We will have, I think, some information kind of at the end on a lot of these resources that are available, okay? And here in your area.
Also, a lot of folks taking photos. We'll have this whole presentation available
Yep.
on our website. We're recording it as well, so you'll be able to watch it online if you'd like. But we do have these pamphlets with local resources. These are all available online, our website as well.
And these are a lot of them local to you here and around. So I think you'll have, it's not just, there's some national and larger kind of support organizations, but a lot kind of here that you can access. Okay. Your behavioral health, I can't emphasize that also enough, because there's a lot of depression, maybe anxiety. They can help with the cognitive assessment and screening. Ours do. We have a team of behavioral health psychologists, and they will help with the cognitive evaluation and screening and so forth. Okay, so they kind of come in and help. And then they can also then come in and help support family, the caregiver side, and kind of help, other advanced care planning and things that I think are important regardless, but ever more so here. They can definitely be a part of that. So that would kind of come also through your PCP and the team, wherever you might be, to kind of help support that and access behavioral health. Okay? And then, let's not forget about our caregivers. They also, as things kind of increase, their health also is affected, and they kind of put a lot of their efforts and whatnot to support someone, and then they also then start to have their own health issues, and maybe they're trying to navigate this with changes and so forth and what they do. So they need to be there. And I highly encourage that your family member or someone really close, a good friend that knows you, is there like at visits with you and can kind of be a part of it, because a lot of times they either can have an outside perspective, but they also can be there because they might need some support there that we can kind of connect to our care management, or if there's resources and things that we need to do. So they should be a part of it as well. Okay. To kind of get to the elevation bit a little bit, I think this could be a little bit too distance to kind of accessing like neurology and specialists, right? Can be a little bit more difficult. Sometimes, maybe not this last winter, but most winters, maybe that kind of isolates more people a little bit more during the winter time, and being able to kind of access that stuff, that might be. And, you might be, in an area where it's a little more transient. Like people are here for part of the year, and then they're, they go down to, I don't know, Arizona or other locations too. No, people love being up here. Yeah. So that I think that's if that's there, that sometimes can pose some access things. But there is something to say in terms of like just lower oxygen at a higher level, okay, and its effect on the brain, especially kind of aging. And one that kind of relates to this is sleep quality and how it's affected. And especially if you have underlying like sleep apnea, or you obstruct and you stop breathing in your sleep, because then your sleep's affected, sleep quality is affected, deep sleep and so forth is affected, and it affects your risks and so forth with that. Okay, that applies to us, in the Denver area and there too, but ever more so should you have that there. So it's really important to manage that and to control sleep apnea, or to help with sleep and insomnia and so forth that might be affecting that. And then you might think about other things that affect sleep: pain, urological stuff. You're up going to the bathroom 5 times a night. Well, you're not sleeping, right? That's important. So attending to these may improve your sleep. So it's not always that you just have insomnia and you can't sleep. There may be an underlying cause to it that you can kind of help, okay, and treat. Okay, so it's not an end if you have cognitive impairment or dementia. And in fact, actually, kind of earlier the better that you can kind of do that, because there's a significant delay in accessing resources and getting a diagnosis and trying to help, okay? And then it's there, and I have individuals coming in with their family members, and they have advanced dementia, and they're trying to figure out what to do, and there's a lot going on there that, and it hasn't really been diagnosed officially, but it's coming later. So we need to engage earlier so that we can help and we get the right things in place. And so you need to continue your physical activity and your movement here, okay? Keep moving, okay? Walking is fine, okay? If walking's not easy, then, moving the body, in a different form that can get your heart rate up a little bit, okay? But just walking, modest walking. Cognitive engagement, okay? You want to engage your brain, and you want to be challenged, okay? You want to do things, even if you can't solve or get the result of something or understand it. That cognitive engagement, learning something new. And the other side of the brain, music and art and things, okay? Engage in those other things, okay? That helps. Like you notice when you get weaker in your muscles, you don't use it, you lose it. You got to use your head and engage, okay? You've got to. Sleep, like I mentioned, is important. Did you have a question? No? Oh, okay. I thought you had your hand up. Home safety planning. For those times, it's going to be important, if that is becoming an issue, that you need to kind of plan accordingly, should that become an issue out. But I think you're in a lovely community here with your neighbors and so forth. I think people will take care of each other here and support each other. Legal and financial, okay? Advanced care planning, those need to start. We should all have it. Our 30-year-olds should have advanced care planning and have those documents in play. But ever more so, we should have these done. Our team, your PCP's office, our care team, care manager team can help, okay? So if that's not present, I would ask to help do that. It does not need to be notarized. You can do it simply with your provider or care member, and then it's a legal document that you'll have that your medical team can have too on file. Okay, and there's plenty of support and support groups around and lots of resources that we'll provide. Okay, so just want you to think about the calls that we need to make when you do it. Okay, when you see any of these changes and they're disrupting life and they're recurring, say something. Maybe it's to your family member, or maybe it's something that, when you see your primary care. Okay, and you're concerned that this is happening. Well, yeah, that's something we can help clarify and help you kind of figure that out. Then for you to just kind of think if it's something to be concerned about, or it's just something that's part of something else. I didn't mention though, otherwise there are secondary causes that you do need to be kind of aware about, and that's part of why you would go in to also see your primary care. Okay, depression was one of them. Okay, these things mimic dementia, but you don't have it. Medications. You may be on a number of medications, and boy, do a number of them cause sedation and cognitive impairment and slowing and whatnot. And so it's in fact actually an adverse effect of the medication. So that's the important part, is that if we figure that out, we can make a change or get the medication off so that we can make a difference and that things clear up. Okay? So always look at your meds, always question if that is a thing that comes up. Is that something contributing? There are B12 deficiencies, okay? It's not easy to be deficient in B12, but it can happen. If anyone has a vegan diet, eventually if their diet's not specific enough to incorporate those things over some years, they can potentially develop that. And then there are some other causes to having a B12 kind of deficiency, but that can actually cause or mimic. And then thyroid, like a hypothyroidism. So low thyroid gland and its low thyroid hormone can mimic basically dementia or the symptoms of it, okay? So that's part of the looking into screening and maybe making sure that nothing's contributing to this that we actually can help solve.
With red, I know that with the Mediterranean diet, you're supposed to have more fish, but what is the thought on red meat now with protein?
Red meat can be a part of that. I think you just need to think about highly saturated fats and a high red meat intake. Someone who's eating burgers and steaks and things like regularly, there's other health effects, good and bad, from that as well. So it's not just the dementia part risk, but it is there as it pertains to the diet. And so the least you can be in terms of a processed food, processed diet, and with your Mediterranean style kind of diet, so to speak, has your best benefit for your brain and for your health. Okay, there's different ways to kind of get to it. Okay, so we have about 10 to 15 minutes, but I want to take an opportunity. Questions? So if you have questions, you can feel free to write it on. And we will stay after 2. But we'd like to have a couple of your neighbors here come up and join us. And we want to just kind of talk about their experience kind of navigating the process and how they kind of engaged with it and things that came up that maybe they wished maybe they engaged in or did and their thoughts on this. Okay, so I think, would that be okay? And we'll have you come up here to the front. Okay. Well, thank you guys for, do your neighbors here, does everyone know your friends here?
Gary, don't say a word.
Okay, let me have you just introduce yourself just
Okay.
for everybody, and then we'll.
Hi, Melinda, my bride, and Woody Van Gundy. We've been residents in Summit County since 1972. And in Frisco,
Yeah.
Summit County.
So since
To give a quick maybe synopsis,
Sure.
Melinda was a real estate agent for 45 years here in Summit County. 2017, she started to experience some problems with contractual agreements and making appointments and a number of different things. So we reached out to a neurologist, and they did some testing. And at that point, she was diagnosed with mild cognitive impairment. And she's gone through the last 9 years. We've had probably 3 different levels of testing that she's gone through. But in 2023, she suffered a small stroke. And she was diagnosed at that time with vascular dementia. The vascular dementia was accelerated by the stroke. So it started to move things along just a little bit faster. And we have video conferences with our neurologist every 6 months. The last visit that we had, they recommended that we have the blood test done for her, which she did do, along with an MRI. And the MRI was not significant, but she's had the presence of white matter in the frontal part of her brain from the beginning, from about 2018. But the blood marker came back with 100% accuracy that she now is moved from vascular dementia into Alzheimer's.
Great. Of course you can.
My mother,
Oh yeah, I left that out.
Yeah.
You want me to do that?
yeah,
Yeah.
I'll get through it.
So a couple of other things are, Melinda's mother died at 75 from Alzheimer's. Her sister, 2 years younger, has severe Parkinson's. Her brother, that is 69, full-blown Alzheimer's. She has sleep apnea that she's had for about 4 or 5 years, so she's on a CPAP machine at night.
Which is wonderful.
So, and that's an exceptionally important thing to do for anybody that has any of those kind of symptoms at this point. Did you want to say something?
I can't think anymore.
Okay.
Okay, it's all right.
I just can't.
Yeah, that's okay. Could you maybe just walk us through or tell us a little bit about your experience before, kind of working on that diagnosis and connecting with your primary PCP and then like neurology, especially kind of where you're at here and how easy that was, or were there any barriers to, getting connected there and time and whatnot? Because were you delayed at all in terms of working through this? Because there's a lot of things that you actually worked through.
Do you want to say something?
My journey started with my children, our children, and they noticed that mom was not mom.
Yeah.
And they wanted me to have a test for Alzheimer's, which I did. I got a couple of referrals and we went down to Denver. Oh, it was hard. They put you through, which is what they're supposed to do. Math tests, all different. You've probably all been through it a little bit, but the tests were a bear, and they were for my benefit. And that was the first one. And then we moved on to, I don't remember after that. Oh, we were referred to when we had our condo out at what was that place?
Stapleton.
Stapleton,
yeah.
big word.
It is. It is.
We had a condo that we owned
Yeah.
out at Stapleton, and, yeah. We were there quite a bit.
Yeah. Well, I think that as far as the medical services here, I would say Dr. Cow has been instrumental in helping us navigate this entire journey through the whole time.
Absolutely.
Really been instrumental
Absolutely.
in that regard. We reached out to UC Health, found a neurologist. That's who's been constant with the decision-making process and all of the testing. Does a lot of people here know what the Montreal cognitive assessments are? Some people are shaking their heads. But it's, you can explain that if you want to, but it's basically a test that is gauging where you are in the terms of a potential dementia. So it's a 30-point test, and it tests, I think, 5 different areas.
Dementia scenarios.
Yeah, of cognitive thought processes. And then there's even more difficult testing that she's endured, which takes 3 to 3.5 hours of testing to go through to really give you some insight on how to find where you're at. That's important. It's really important to be able to understand, because things will start to transition, and you have to be able to recognize the fact that you're going through some of those things. It's not comical, but we have a lot of stories of some funny things that have happened along our journey where, a year ago, she would I'm going to go down to Main Street to one of the stores. And for a while, that worked out really well. And then one day, a truck pulls up with her in it because she got lost. She didn't find the store that she was trying to get to, but she's a very astute conversationalist, and she struck up a conversation with a couple of construction workers, told them where she lived, and they said, well, hey, we'll bring you home.
Yeah.
We're really blessed to live in a community where you have those kind of conditions,
Oh, absolutely.
and where people are always so helpful. That's a really big part of it.
It's a community.
Yeah.
Yeah.
It's a community.
So,
It's a darn good one, too.
Yeah.
but yeah, we recently just came back from Arizona to see our daughter and grandchildren and husband. We stopped halfway down there, but I lost her in the elevator at the hotel that we checked into in Cortez.
It's
I mean, literally walked out the elevator, went down the hallway about 20 steps and turned around to come back and get her, and she was gone. And it took us about 25 minutes to find her.
Where was she?
She was kind of circling but to her benefit, she went to the front desk and said, I have dementia, I need some help. They looked up her name and they brought her to the room. So
these are resourceful things and things to
They
be aware
are.
about that can
Yeah.
help when you're in situations like that.
Right, absolutely. I mean, we were in Arizona, we were shopping at a Safeway store, and I was checking out. She was standing next to me. The attendant, she talked to the attendant and said, I'm going to the restroom. And then I looked and she was gone. I bagged up all
Yeah.
the groceries. I went over to the bathrooms and I waited for her to come out, and she didn't come out. So one of the people came in and got her, or
Yes.
said, oh, she's not in there. Well, that was another 10 or 15 minutes of going around Safeway, and I'm looking all the way down at the end of the store, and I see her walk in from the outside back into the store. So we've had to resort to a number of different things that, a good example is, air tags in her shoe. She has air tags on her glasses. She has air tags on her little shoulder bag. And then her phone, which is a Lively phone, we She used to have an iPhone. It got to be too complicated for her to navigate. So we got the smaller flip phone. It has an emergency call number, which has come in really helpful as well.
This?
And then, no, that's okay. And then we did get her a magnetic bracelet that has all of our family's phone numbers that she wears constantly in the event she were to get lost, or
Again.
to, you know, at least she can let people know what it is she's dealing with. So for the most part, people are
Yeah.
exceptionally generous
they're
and
wonderful.
helpful when you get into that situation.
All you need
Yeah.
is, yep. It's amazing.
I think so. It's amazing that how you navigated this through and found your way. I think it kind of comes back to having support here,
Uh-huh.
working on that, and then getting connected and working through some of that. If it takes you down to Denver or whatnot, to kind of do some of that. But you know, it does sound like, you know, it's a quite a day and a lot of effort and things that you have to do to kind of work on
Just use
from
your head.
testing
Yeah,
and so forth,
well,
and they can be
It's definitely
tiring.
24/7. You
Yeah.
know, there's no doubt about that. But the one thing I wanted to say, one of the benefits, watching the presentation, it like layers, peeling layers of things that we've already gone through all the way towards the end. One of the tremendous benefits that we've been blessed by here is that I call it's Melinda's 5 angels, which are longtime friends that we've had here for a long time. And they constantly get together on a regular basis. They go to exercise all the time, to different classes together.
'Cause I can't
They
drive.
go out to dinner, they go to shows and movies, which is, having that is as important as anything.
Oh, it's wonderful.
Maintaining a social network is about as good as it can get for somebody. We at one time considered moving to a lower elevation, but realizing that we would be removing her from her social network was truly not worth that process, and put her in a position where she would have to even try to rebuild some of those
Yeah.
kind of relationships is too difficult.
75. I don't want to do that.
That social network is very important around that, sometimes more than anything else that we can do.
It really
Yeah.
is.
And so, you know, having that support, it helps both of you, you know, through this as well,
You bet.
right?
My girlfriend will call me and say, do you want to go to exercise class at Silverthorne tomorrow? I'm on. She's at my door.
Yeah.
And it makes a
Well,
world of
it's a
difference.
value to me
Home
as a
since I can't
caregiver,
drive.
because
Yeah.
when there's somebody else with her for a short period of time, it allows me to catch up on all the things that you do on a regular basis.
People need
Whether
people.
it's shopping or cleaning or just taking a short
True.
break, you know, which is
Yeah.
pretty important as well.
Very true.
So,
Excellent, great,
yeah.
thank you. Does anyone have questions about any experiences that you've had yourself, or anything that you know had come up here as we've chatted?
Mine's not really an experience, but I just want to really applaud you for sharing and opening up and being authentic and talking about this, because there's so many people who don't talk about this in their families.
Yep.
And it's a stigma maybe, or embarrassment maybe, or you're just not used to opening up. And I really appreciate your honesty and sharing this openly.
Well,
Thank you.
I'm
Yes.
not
Well,
embarrassed.
Thank you.
Yeah.
I'm not embarrassed.
But we're also blessed that we have
What it is.
one of our kids lives here. They live here in Frisco. They have, and the grandchildren and daughter-in-law. And that's a massive help too, as part of that whole social network that we have.
Just go.
So,
Just
yeah.
get it
Great.
done. Don't hide. Don't be embarrassed. Hold your head up high and live your life.
Yep.
That's what I'm doing. Exercise is a big help. It helps you get rid of your stress
Yep.
if you have
Oh, sure.
stress or whatever.
You're doing a wonderful job, and so I think you continue to do what you're doing, and We're supporting others that, may either have a family member or, themselves are going through something similar. So I think this is wonderful to share.
Well, thank you very
Yeah.
much.
Yeah.
And if anyone has any questions, we'll be around for a few minutes. We'll
Are there
be more than
any
happy to
other
answer.
questions in terms of any other outstanding questions anyone has written down or has?
Dr. Cowie worked really hard on this.
She's amazing, isn't she?
Yes, she is amazing.
Okay.
She is amazing. She's our fave.
One question was, what do we know about new dementias? So like late dementia, how to identify in different treatments. When we say late dementia, we're referring to, over 65 or even beyond, or versus we usually see things as like early dementia onset and get, that where we kind of dig in and try to figure out, what is occurring there. And then late dementia, is kind of a broad topic. Dementia, as we talked about, can be a lot of different things. And so I think one of the important things is trying to uncover first, is it mild cognitive impairment, maybe aging, or is it actual underlying dementia? Is there something causing these changes, a secondary cause, something that we can find and test and treat and resolve versus moving us kind of down the pathway to further imaging or testing to kind of find that. The treatments are the treatments. They're the same treatment right now. And really, the treatment is to try and prevent
Yes.
right now through a lot of these behavioral changes in diet and other things that it can do. Even when there is maybe some cognitive impairment or dementia present, treating the sleep apnea is important, because when the sleep's not affected, then everything changes, even further. So, that's an important aspect before and after, or during. Yes.
Excellent answer to what you thought the question was, but actually.
All right, tell me.
Question, and I've been reading about a new diagnosis. Orphic predominant age-related TDP 43 encephalopathy.
Yeah.
Late, and apparently, specifically, it's not Alzheimer's, and therefore it wouldn't respond to any Alzheimer's treatments.
Right.
It's fairly new, and I don't know if there's anything in that realm that's developed.
There's not a lot of treatments there. There's not a lot of diagnostic testing specific to it. It's a lot of this is research in terms of seeing some of these things. So it can be a little bit academic right now in terms of finding out these things, but there's not as much that we can change the course for it, but they're seeing differences. And that kind of gets to, we use dementia as an overall thing, but really there are probably a number of things that are kind of sitting within that umbrella that we don't know. And so it's kind of gets wrapped up potentially into Alzheimer's, until we kind of determine, hey, it's a little bit different here. Or we find vascular dementia and we know that that's affected, and we start, so more and more do we find that, and then more testing to kind of differentiate and do that, which then, why would you test in that? Because if you know what is causing the problem, like diabetes and stuff, then you can get to either prevention or you can get to stopping it. What if we can diagnose this early and then put a pause on it? Okay, so we don't see progression. All right, and if we get to it early, diagnose it, and then it stops, that's good too. Maybe we can't cure it, but we can put a pause and it doesn't progress. Okay, but we have to know what's going on, and these things come. But yes, you'll see more and more of that kind of coming out. there's not a lot of great kind of evidence and support yet in terms of that. It's kind of really new. Yeah, great.
The very last comment I have is my children are the reason that I went to the doctor, because he was part of it too. They all noticed Mom's different. Mom's changing. Mom's, yeah, I didn't know what was going on. But
Yeah.
that's what I did, and we went down to, by Swedish Hospital. Oh my gosh, the tests. Don't
Yeah.
back away
Okay.
because of the tests. I wasn't smart enough to do all these different math
Yeah.
problems and all this stuff,
But it was you did it, and you have a good
I
you have a
did
good
it.
support.
and they had a good report, and then I went again, and then things started changing. So
Yeah.
my children, our children, are the reason that you're here. It's best.
At what point do you recommend memory care facilities?
Wonderful question. That is so at what point do you recommend memory care facilities?
That's a good question.
It's a personal thing, but two things really are kind of come to mind are important. Safety, when safety is an issue, okay, and the caregiver. When your partner or caregiver, is struggling and can't really take great care and be there and support well enough, and there's a safety issue that comes, and maybe they've hurt themselves or they've gotten lost, and there's now it's hard to manage. Those two are probably some of the most important things that then kind of help determine that. And then that's when you can have a conversation with care management and support with your PCP to kind of talk about that and find support with that, where it is. Because it is a big decision. I mean, it's, you're still kind of separating yourself somewhat when you're making that decision. It has nothing to do about giving up or not being able, wanting to support or be there, but sometimes those are the steps that need to be made. And I think that's probably what pushes most people to kind of make that decision.
I'm covering here.
Yeah.
Running
We're running out of time? Okay.
One more question?
One more question.
Okay.
Any advice for children with a parent with a diagnosis but lives in another state? Yeah, I mean, it really, it's hard, especially if there's someone with dementia and they're out of state. But I think keeping a routine for that person, engaging, that social structure is very important, and being there, whether it's in person or not. Finding different ways to kind of connect with your parent, your family member when they're not in the same state, because it'd be hard to do. And then, finding ways to do some of those activities and engaging with them that we talked about, but kind of virtually, and kind of being there if you can't be present. But making sure that there's support and you've got good resources around here that are there for your family member, your parent, when your family can't be there with them. Okay. Yeah.
That's very good.
Great. Okay.
Steal the mic.
Yep.
Thank you all for attending. Would you mind putting the QR code up?
Yes.
So if you could give us some feedback, there's a QR code circulating all over the place. It's on papers as well. Zach will hand them out. Thank you so much to Dr. Kramer.
Good. Thank you. Yep. Yep.
And then one last plug for primary care. So if you don't know where to start, your primary is really the place to do that. And so obviously, Bias has been at Elevated Community Health now for 14 years. Thank you to some of my people who came here today. I'm grateful. Our primary care team is accepting patients, and so if you are looking for someone great to provide holistic, person-based care, we'd love to see you. There are pamphlets on the table on the way out. We provide primary care, behavioral health, and dental services, all in one location, and so we'd love to see you. Thank you again for attending, and as Jack and Curtis mentioned, we will have all of this posted on our website that you can reference it later and share with anyone that you feel would be helpful. Thank you so much,
Yeah,
Dr. Kramer, for
thank you.
coming up. We really appreciate
Yeah.
all of this. It was great.
Thank you. Yeah, appreciate it.